You are walking through one of several Wuhan field hospitals. This one, a converted exhibition hall. It is aimed to contain the spread of the novel coronavirus. Notice bed after bed after bed, people crammed in, just feet apart from one another. Portable toilets, a bit messy inside, and trash cans overflowing. You can see the piles of used face masks. The woman who toured CNN via video chat through this field hospital tells us the conditions here worry her. Fearing repercussions, she asked we call her Lisa Wang, not her real name.
There's a great danger of cross-infection, and there are people who are healthy and got taken here by mistake.
Chinese state media aired images of the same field hospital before it opened, much cleaner inside. Wang says she and others here are recovered and healthy, and were still forced into the facility.
I'm very angry because I feel I shouldn't have come here. I'm very anxious. I want to be back home soon.
Wang contracted the virus in late January, but fully recovered within a couple of weeks. Both her CT scan and swab test results show that she twice tested negative. But officials still bussed Wang and several others to the field hospital for further treatment, despite her negative test results.
They told me if I refused, they would force me to go.
Bo Hanlin faced a similar rounding up in Wuhan. His wife was a confirmed case, so he was listed as a close contact person. But his first two tests came back negative. The neighborhood committee tried to hospitalize him nonetheless.
I felt quite angry about this because there are so many people who have not been hospitalized at the moment. Why would they quarantine the healthy people?
CNN reached out to the Wuhan Health Commission to better understand how the field hospitals are being used and to ask why people whose medical records show they're recovered were taken here. We've not yet heard back. People in all kinds of circumstances are getting rounded up in multiple parts of Hubei province, the epicenter of this outbreak. In Tiananmen City, the local government said they picked up people who were disobeying police orders to remain off the streets and have confined them to a gymnasium, all part of the strict lockdown policies. After Wang complained to local health officials Wednesday, she acknowledges they responded swiftly. The next morning, she says she and 6 others who had likewise already recovered were transferred back to the hotel quarantine. She's still bothered by how officials initially handled the matter.
They couldn't provide me with a hospital when I was sick. Now when I'm recovered, they forced me into one.
For several weeks now, the World Health Organization has praised the Chinese government and their handling, and particularly their containment efforts, Linda. Even some have considered them extreme, but they may be effective. The World Health Organization standing by their words today. In fact, I heard from them a short time ago by email in a statement, and they consider this to be an unprecedented crisis, and they consider these measures that China is using to be unprecedented as well. But they go on to say, and I'll read part of this response, and that is that we need to acknowledge that the relatively low number of cases of the virus detected outside of China is as a result of the intensive efforts the Chinese government is taking to contain the emergency and protect other countries, Linda. But the fact remains from folks we've spoken with that there are real concerns as to why the healthy may be rounded up in this, and is that really effective?